with regard to some of the measures mentioned with regard to ventilation, things like portable air cleaners and ultraviolet as a disinfection measure. Are those measures appropriate in all situations in healthcare facilities? Should they be generally required? Are there specific circumstances where they would be required or should be required? And if so, what are those specific situations?
I'll take a start with that. My name is Donald Milton. I'm of the opinion that as the price on air disinfection technologies that are eye safe, such as 222 nanometer UV, comes down, that these are going to be increasingly feasible to be implementing throughout healthcare facilities, but especially in places where people congregate, whether that be waiting rooms, emergency rooms, and break rooms, because these are some of the highest risk environments, because we now understand, as Dr. Prather pointed out, that speaking is an aerosol generating procedure, and that where people speak and are congregated together, the risk is high.
And also with regard to respirators and face masks, with consideration of aerosol transmission, where do you believe it would be appropriate to require face masks versus respirators? Is it a situation where you believe in the final rule OSHA should require respirators across the board in healthcare facilities? Is it simply with regard to administration of care to persons with suspected or confirmed COVID? Again, I direct that to any member of the panel who would like to respond.
Donald Milton, I would like to respond. What we have to do is have first safer air for people to breathe without having to put the onus on the individual to wear a respirator. And I think that when we do need respirators, such as during times when transmission in the community is increasing, then they need to be throughout the healthcare facility, because you cannot do enough testing to know where the infection is soon enough to prevent transmission and protect workers' health.
Yeah, Rosemary Circus. I just wanted to echo Dr. Milton in terms of the National Academy's report basically said, once you know that there's an increased risk, and the increased risk is throughout the facility, it's not, you can't, kind of identify, as you've heard over and over again, for healthcare workers or for any kind of category of people, including grocery workers, other workers, then those people need to be in fit tested N95 or better respirators if you're relying on that for respiratory protection. I have a question for Dr. Milton on the ultraviolet germicidal irradiation. I know that it's readily available in ducts and used in a lot of emergency rooms and other places in hospitals, but the exciting new Far-UVC, which is the 222 nanometer, which because it's got more energy, it discharges superficially in the dead skin layer and in the tear layer. It's not supposed to cause any eye irritation or cataracts, and it's not supposed to cause skin sunburns or skin cancer, which is why the traditional UVGI has been inside ducts in the past. I just wanted to ask how far along that is in terms of commercial availability and, and the toxicology tests for safety. To what extent does it eliminate those concerns?
Yeah, the toxicology shows that in fact it doesn't cause any DNA damage in the human skin, and it is currently deployed in about 1,000 different deployments around the country, including the U.S. Army headquarters and the Pentagon, hundreds of schools in South Carolina, including school buses, at the Atlanta International Airport and other airports. There are several companies anxious to produce more of these fixtures and to bring the price down and make it even more accessible soon.
So one last, Rosemary Circus, one last comment. I would refer back to how OSHA was technology forcing in the cotton dust standard, because what Dr. Milton is describing is the ability to have lamps that could be used in the classroom, in the waiting room, in public spaces, in grocery stores, that are incredibly effective against not only coronavirus, but also TB and also influenza viruses. So that's incredibly important and may warrant additional OSHA looking into that.